Knock, knock. Hello, my name is Steven. I'm your nurse tonight. I'm just going to be doing a neurological exam on you. Is that okay?
Yep.
Do you feel safe?
Yep.
Good. So I close the curtain for privacy. I wash my hands and we'll begin. So first of all, can you tell me your name?
Mariah.
Do you know where you're at?
Yep.
Who's the president?
Joe Biden.
Tell me where you're at.
The hospital.
And what's today?
Monday.
Okay, so client's speech is clear and distinct. She is alert to person, place, and time. Okay, so let's begin now. So we're going to start with cranial nerve 1, olfactory. I'm going to have you close your eyes, cover one nose, one side of your nose, and then just smell for me what this is. What's that?
Vanilla.
Same with the other nose?
Vanilla.
Great. Okay, so patient's cranial nerve 1 is intact, the olfactory. Next, we'll do cranial nerve 2, optic. So with the patient standing 20 feet back from the Snellen chart, she would cover one eye and read the lines till she can no more. And after doing so, patient has 20/20 vision, so her cranial nerve 2 optic is intact. Good. Now cranial nerve 3, 4, and 6. So without moving your head, just follow my pen here. Open your eyes. Good. We'll do this side. Good. So cranial nerve 3, the oculomotor, cranial nerve 4, the trochlear, and cranial nerve 6, the abducens are intact. Good. Now we're going to do cranial nerve 5, which is the trigeminal. I'm going to touch, close your eyes, tell me which side and where am I touching?
Right forehead. Right cheek. Right chin. Left forehead. Left cheek. Left chin.
Okay, now open your mouth. Try open. Okay, now close it tight. So jaw strength is a 5 out of 5 and her cranial nerve 5 is intact. Next we're going to do cranial nerve 7, the facial. Can you smile for me? Can you frown? Can you close your eyes tight? Squeeze them tight. Raise your eyebrows. Okay. So cranial nerve 7 facial is intact. Next we're going to do cranial nerve 8, your acoustic. So can you cover one side of your ear? Do this one first. And I'm going to whisper something, you just tell me back what I said.
Okay.
Pink shirt.
Pink shirt.
Do the other.
Pink shirt.
Good. So cranial nerve 8 acoustic is intact. Next we're going to do glossovagal. So yeah, just swallow for me. Good. Okay. So cranial nerve 9 is intact. Next is cranial nerve 10, the vagus. Can you open your mouth? Okay, now say ah. Okay. So cranial nerve 10 is intact because her uvula rises with phonation. Good. Now cranial nerve 11, the spinal. Can you shrug your shoulders? Now turn your head towards the left. Now the right. Okay, so shoulder strength is 5 out of 5. So is when she turned. So her cranial nerve spinal is intact.
You're a little out of the
Oh, sorry. And the last one, the hypoglossal. Did I say it right? Hypoglossal. Is it? Okay. That's the tongue. So can you just stick your tongue out? Okay. So patient is able to stick her tongue midline. It protrudes midline. So her cranial nerve 12 is intact. Good. Now we're going to test for some coordinations. I'm just going to have you stand up for me. Now, am I in here? Okay. Now, just do this. Have your, and then rotate, touch your nose with your fingers and rotate. Faster. Faster. Good. So, she's able to do the finger to nose, with smooth coordination. Smooth coordinated movement. Now you're going to have to stand like this for 20 seconds. Try not to sway back and forth. This is called the Romberg test. Okay, so Romberg test is negative. She didn't sway back and forth. So now you can sit back for me. There's another one. So we did the Romberg, we did this. Okay, now heel to chin. So I'm gonna have this chin just touch your sorry, this, what is it called? Sole, touch your chin right here and go down.
Chin.
Chin.
Shin.
Chin. Okay, now do the same with the other one. So she's able to do that with smooth, coordinated movement. Okay. So now next we're gonna do the sensory. Yes, sensory. Okay, so close your eyes for me. I'm just gonna touch, and you tell me if it's sharp or dull. Okay.
Dull. 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 Dull.
Okay, you can open your eyes. So patient is able to differentiate between dull and sharp objects. All right, next we're gonna start with your cranial nerves. Or not your cranial nerves, what am I saying? We're gonna start with your reflexes, okay? So I'm gonna use this as my hammer. First we're gonna start with the bicep. Just have you grab me right here. Okay, so bilateral, her bicep is a 2+. And I'll do the same for this side. Okay, so both biceps bilaterally 2+. Next we're gonna do the triceps, so I'm gonna have you extend. Keep your arm dead right here. Okay, so triceps bilateral reflexes 2+. Next we're gonna do your brachioradialis. I'm gonna grab your thumb here and okay, other thumb. Okay, so bilateral brachioradialis reflex 2+. Next we're gonna do your patellar. Can you see? Yeah. So just below the knee, dangle your feet. Yep, just relax them. Okay. Okay, so patellar reflex bilaterally 2+. Next we're gonna do the Achilles reflex. Okay. Same for the Achilles, 2+ bilaterally for the reflex. Now the dorsal reflex, or the plantar reflex. Lift your leg up here and rub along with, it would be my hammer. And the toes do curl. Let me try this one. Toes do curl, so her reflex is 2+ as well. Do you need anything else? Oh, I did forget one thing. Let me see this here. Push up on my hand. Okay, now push downward. Do this one. Push upward. Upward. Yep. Downward. Okay. Now grip my hands tight. Okay, so her hand grip and her hand grip is a 5 out of 5, and her dorsal plantar flexion is a 5 out of 5. I think we're all done here. Do you need anything?
No.
Okay, you have your call light here. Call me if you need anything. I'm going to open your curtain. You want your door shut or open?
Open.
Okay, I'm going to wash my hands and call me if you need me.